Welcome back to Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and today we're going to focus on choices that will help with your health and protect your budget as well. The supplement industry has exploded. I mean, there are supplements everywhere, and medical foods is a similar subject. But I'm not talking about like medical foods like beets and kale greens and that kind of thing. What I'm talking about are prescription or supplements that are more medically driven, more data behind them, and so forth. So they're not the same as the traditional supplement industry that we often think about. So today on Your Health, Your Wealth, we want to help separate medical foods from supplements and talk about how you talk to your physician or your clinician about medical foods or supplements, and then how to avoid paying for something that you don't really need. And I've got an industry-leading expert with me today, Dr. Eric Kassel, who I'm going to introduce in a second. I'm excited about diving into this and going through some of the myths that we sometimes hear when it comes to this industry, and finding out how learning more about the supplement industry can lead to better health. So the supplement industry is valued at over $210 billion as of 2025. And the North American market is probably about 35% of that, an estimate of $65.9 billion. And this market is growing, largely is fueled by this interest in health and wellness. And so we're not talking about a small market here. And think about when you go into CVS or Walgreens, or your local grocery store, there are rows and rows of vitamins and supplements. And I'm not against the supplement industry. I personally take supplements. I recommend and prescribe supplements and medical foods to my patients who want to do things in a more naturopathic way for treating their condition. So this is an important topic I think you all need to hear about, and we have got just the right person to talk with us today. I'm joined today by Dr. Eric Kassel. He's the Director of Clinical Affairs and Medical Operations of Alpha Sigma USA. So Eric, it's good to have you here. He's a pharmacist for over 25 years and has a lot of regulatory experience with regulatory affairs as well. He's launched numerous products throughout the industry. So happy to welcome Eric Kassel, Dr. Kassel, to the show to shed some light into this supplement industry.
Well, I appreciate that, Dr. Patton. It's a pleasure to be here, and I've developed quite a passion for medical foods, but for supplements and just how we can support our general health and longevity as we live in an era where our food source is not giving us the nutrients they used to.
Absolutely. So before we really dive into this, why don't you just tell listeners a little bit about your path and what you do on a daily basis?
Sure. So, as you mentioned, I am a trained pharmacist. I have my doctorate in pharmacy. I started my career as a clinician, a clinical pharmacist in a trauma center in Chicago, doing a lot of non-traditional work, but really helping hospitals create a safer environment and economically respectful environment in a trauma center, which can be a challenge at times. But over the last 25 years, I've spent in the industry helping organizations support their products with good, solid medical information, safety monitoring, research, and education to not just healthcare practitioners, but to the general population. So I've shifted my roles over the years and really kind of created an intersection of the evidence, the education, the operational side. And at Alpha Sigma, that's kind of the role I am playing. So I'm looking at how our medical food products help support different conditions and diseases, but then how we get asked constantly about supplements. Why can't I just use a supplement for this? What's the difference with the supplements? How do I, pick a supplement? There's hundreds of them on the market for each of these different molecules. So it really becomes a little harrowing when you're trying to choose something for your pocketbook, but also ensure that you're getting the support clinically and medically for what we need. It's generally been a treat to dive into medical foods this way. We kind of partner with different parts of our organization to make sure, we're looking at it from a practical standpoint, looking at dosing, kind of how we document, how we
Mm-hmm.
look at that, help people guide their payment. Can they use their HSA? Can they use their FSA? How do they get those with the goals of really how do they use nutrition thoughtfully? How
Mm-hmm.
do you measure that progress and how do you avoid waste? Because that's the biggest pitfall people fall into.
And you've said already, mentioned medical food a lot. And to most listeners or most people out there, they probably don't know the difference between a supplement and a medical food is. Like I mentioned, you say medical food, they're thinking, kale greens and leafy green vegetables and so
Yeah.
forth. But, give us a little simple explanation as far as the difference between a supplement and a medical food.
It's a great question, and it brings me back to food is medicine in a
Mm-hmm.
sense. So you talk about kale greens, you talk about green leafies, they are medicine. So it's an interesting intersection. Now, my first foray into medical foods was almost 25 years ago. I had my firstborn was ill and needed a medical food supplement directly from the industry. I couldn't buy it at the store. And that's what my
Interesting.
first engagement was, some food, a baby formula. So, but now diving in, I didn't know much about the regulatory process and the difference between supplements, but these are medical foods are quite different from supplements. Add nutrients. It might be plant
Mm-hmm.
compounds. These are people who are looking for kind of a general wellness to fill gaps in their daily health plan.
Mm-hmm.
So you buy them off the shelf. It's kind of self-directed. They're in amounts that are really in conjunction to the recommended daily allowance. These are regulated by the industry or by the government, but under a certain aspect of it called the Dietary Supplement Health and Education Act. So it is a law. They have to follow certain standards, but they can't make claims about diseases and health that way. Just general supports cardiac health, supports bone health. Medical
Mm-hmm.
foods are quite different because they're specifically formulated products for the dietary management of a disease or a condition
Okay.
with distinct nutritional needs. So it's a disease that's been supported. It's got a lot of science behind it, a lot of research that says, hey, due to this nutritional deficiency or these nutrients, this disease has a kind of a foothold in our health. And in
Mm-hmm.
order to get those nutrients, you need extra help. So you can't get them through your normal daily, intake of foods. Now, this might be like a diabetes. Diabetes is a metabolic disease. It comes with a lot of absorption issues, a lot of challenges of our body using, sugar and transporting sugar. So it becomes a metabolic disease. That's
Okay.
a perfect example. So medical foods have to be used under a physician supervision, a little different
Mm-hmm.
than the self-directed supplement market. And it's not a drug, though. So it can't claim to treat or cure disease, but it helps to support the targeted nutritional support of a condition or a disease. So through that
Mm-hmm.
targeted nutrition, that's how the treatment comes. And it might come with secondarily with some symptom treatment and some symptom relief, but it's really the focus of the nutrition foods that are feeding whatever the disease is needed that we can't take in on our own.
Wow, that's interesting. So what I'm hearing is that you have like this nutritional need, and if there's a nutritional need and you're under medical supervision, there's a higher level of kind of medical scrutiny and studies and so forth. Then that's more in the medical food category, and
Correct.
everything else pretty much is a supplement.
Yeah, and supplements are, they have general science behind them, so we don't have,
Uh-huh.
supplements that don't have kind of a known, support system in our health. They aren't in any disease. It's kind of this general health support, and they really are regulated or guided by the recommended daily allowance. Where here, medical foods are kind of therapeutic doses. They're usually
Mm-hmm.
higher quality because we're going through a similar manufacturing process as medications. We don't have to keep that level, but a lot of companies bring it up to that level. Because it's a need in having that quality, that guarantee, that potency
Mm-hmm.
to maintain that versus the standards on the supplement side are not the same.
And I want to dive into that a little bit deeper because I'm often asked about the cost and looking at outcomes versus the cost. And when patients ask me to either recommend one supplement for over another, or I might write a prescription for a medical food, and they say,
Mhm.
"Well, why can't I just get this similar supplement over the counter?" I often tell them or talk to them about the regulatory pathway of one versus the other. And I often use the story of, let's say, I want to make a B12 supplement, and Dr. Kassel wants to make a B12 supplement as well. We can both claim to have 10,000 micrograms or 5,000 micrograms, but it's in how we make it. It's the things that we cut it with, different. And
Mhm.
some of these supplements are, they use some ingredients that a lot of people, if you knew what was in it, you may not necessarily buy it, but there's differences in bioavailability,
Mhm.
and different things like that. So that may be why my B12 supplement may be $50 for a 1 month bottle, and yours may be $15 for a 1 month. And if to the layperson, they go to and they see 50 versus 15 and say, hey, I want this. But there is a difference in how things are made. So am I off on telling people this, or what's your take on that?
No, no, it's pretty accurate and spot on. I think back 10, 20 years ago, you didn't have the competitive nature and the amount of choices we have at our fingertips. The age
Mm-hmm.
of the internet, the big companies out there that provide access, doorstep, next day delivery. It's really changed how the market has grown and shifted. And now you get a lot of competitors. You get a lot of
Mm-hmm.
companies on the market almost overnight. You get something successful that's growing, and overnight you have knockoffs. You have generic versions. You have supplements that can claim that, hey, we have the same ingredients, but they don't claim, the disease part. And as we've looked and started to test those, there really is a difference. There's a potency
Mm-hmm.
difference. There's a quality of ingredient difference, stability differences. And as you mentioned, the fillers and the other things we have to put in medications so that they are stable and they package well, they get into the capsules or tablet form. Those are coming under a lot of scrutiny.
Mm-hmm.
We recently, the last couple of years as a company, looked at that and said, you know what, we have to do a better job. And we challenged ourselves to free up and clear up all of those things that might cause inflammation, might cause oxidative stress in
Mm-hmm.
somebody, even at a little bit when we're trying to treat inflammation and oxidative stress in some of these conditions. So we felt as a leader in the industry, we needed to approach that in a different way. And so we've done that due diligence, but we've also seen other ones. We've seen quality testing where
Mm-hmm.
generic supplements come on the market and they are treating cognition or they're supporting cognitive health, but they have heavy metals in it. That's exactly not what we want,
Yeah.
for our cognition. So it's kind of the old adage, buyer beware. If the price looks too good, it's probably too good to be true. So you want to stay with, focused, branded, top brands, and medical foods. You kind of skip that need and that decision because we have an FDA standard, and Alpha Sigma, we have a very high we go above those standards from a manufacturing. We own our manufacturing, and we're very concerned and focused on that portion of quality.
And is there a difference in how people can pay for like supplements versus medical food? Like, is it really like a prescription? Meaning, do your insurance companies cover a prescription grade medical food versus a supplement? And can you use different accounts like FSA or health savings accounts?
Yeah, generally, FSA, health savings accounts cover supplements. They cover your over-the-counter medications. They'll tell you, each of your plans will tell you and identify what's not covered. A medical food generally can be pushed through an HSA or an FSA. They aren't recognized. And a number of years ago, there was this discussion about their what medical foods were, and insurances decided to put them in a category where they did not pay for them. So general commercial insurance, Medicare does not generally pay for them. Some states are starting to buy in and buy on with some of these. So there's certain states across that have made that decision, especially on the Medicaid side, to to cover some of these depending on what they are and what they're for. And that's encouraging, but it's always slow because payers, they have a budget and they have stakeholders to answer to as well.
Like I said, in my practice, I do write for medical foods. I also recommend supplements, and that's one of the big issues that I run into is medications are just becoming more and more expensive. Patients are having to do different things, make sacrifices, and sometimes when they're looking at like a supplement or a medical food that a doctor is prescribing, they don't put it on the same tier as their prescription medications, and it can be an issue. So it's important for people to clarify that up front as far as the cost. But not only that, other things like, how long are they going to have to use it for? What's the goal? Are you just going to be on this forever? I have so many people that come in and they've been on this supplement for years, and I'm like, well, why are you still taking vitamin D? Well, I don't know. No one ever told me to stop. Has anyone ever rechecked your level or seen like what is the stop point? So I try to have those type of conversations and you can speak to this. I mean, it's not a benign thing. Like there's some vitamin supplements that are water soluble, others that are fat soluble. If you take too many, it can affect your kidney. So one thing I always do, I have patients come in with these grocery bags full of supplements, and I'm like, okay, I need to check your kidney function to see how things are going.
It is a key piece, and that's why I like kind of the medical food supervisory aspect. There's definitely that communication and that design with your healthcare practitioner, with your team, to monitor, manage, provide goals and outcomes, and follow up to how we monitor these things. As you mentioned, water soluble vitamins generally are we can take care of those, but there are cases where you can see toxicity. You can see overdone, or if you get a quality issue, I know of cases, where we've seen that, and we've seen somebody get into, problems with their liver because of the quality or the amount. So they were taking a gram of this, but they were actually getting a couple grams because of the quality and potency of it was off, too much. And then they pop up and they, jaundice one day and they have liver problems, and they're in acute liver failure, and now they're spending 3 months of their life trying to recover from that. So it is safety wise, it is, a concern, but generally oral, I still see a big, kind of generally regarded as safe. That's one of the medical food aspects, the categories we have. It has to be something that's generally regarded as safe. So I call it the blunt scissors. You you can run down the stairs with them. If you fall, it's not going to hurt you. Uh, you really have to take a lot to get in trouble.
You're in this industry. You've seen a lot in this industry. When does a medical food make sense for a patient if they have one of these medical conditions that
Mhm.
is when are just going on your own and getting supplements versus medical food? What makes sense?
Well, I think you nailed and the first one is you kind of have to have a condition or a diagnosis that has that distinct nutritional needs, that targeted nutrition that you cannot take in on your own.
Mm-hmm.
I mean, you're a physician, you've been practicing for some time. Just about every disease has a nutritional diet exercise aspect to it, and you have
Yeah.
to get those you have to give those parameters in there to take it over, but it's really difficult. It's really
Mm-hmm.
difficult with our demands in life. So the second one is really there's some lab and clinical findings that point to a specific nutrient pathway
Mm-hmm.
that targets the support, that needs targeted support. And then you have this plan aspect. So how to plan a plan and monitoring response for the symptoms of the disorder or disease, and when it's appropriate to follow up with labs and monitoring. So I think
Mm-hmm.
those are the three key pieces that tell me, okay, that's a medical food. You know,
Yeah.
that's not a
Yeah.
supplement. I need help with this, and it needs to be monitored in an appropriate way.
Mm. And it's also important for people to know that if you do have that vitamin deficiency, it does not mean or it does not replace, eating healthy, like trying to get these and nutritions from your food intake, and don't stop eating just because you're taking this vitamin. Oh, I'm getting all my vitamins through my
No, no,
supplements.
no.
You really your gut needs that natural process.
Yes, yes, it does. I've recently, as I've gotten older, hit the epiphany of I can't eat like I used to, and so yes, I've gone through a mass transformation against the better judgment of my family to go
Uh-huh.
all natural, grown food, try to get it in its natural state, and it's changed. It's changed the entire family's face of their health. Having a type 1 diabetic in the house, his A1C would be 7
Mhm.
to 8, and it was 6.3 2 weeks ago, because
Okay.
he's changed his eating habits, what kind of food he's eating, and really followed suit just from a behavioral modification. And he doesn't cook, so he
Mhm.
has to rely on me.
Yeah. There you go. For the listeners that are listening, can you give some touch points that they should take into their next visit with their physician, or whoever they have taking care of their health? Some different checklists when looking at this industry of supplements versus medical foods, things that they should consider.
Yeah, yeah, I think there's a number of questions that you can bring in to help with your care team, with your whether it's a physician or they're telling you, "Hey, I need you to talk to a nutritionist.
Mm-hmm.
We need to get this better under control." Really, what's the specific nutritional needs that are targeted, and how do we measure those? So those are some key aspects. Why a medical food instead of a standard supplement for them? I think we kind of covered why you would choose a medical food, and it's that condition base. What's the dose, the timing, the duration? Should I follow? That's an important
Mm-hmm.
one we touched on with your story about vitamin D. How many people, Medicare people, come in and they've been taking something for 2 decades and they don't know why anymore.
Mm-hmm.
What are the labs? What are the symptom scales that I want to be tracking? That I want to look out for, that I want to tell the doctor, hey, this seems to be getting better. That's those are key aspects for your own health, but to understand that, hey, I'm taking this medical food, and guess what? I'm now feeling better. It's
Yep.
actually working. Half the problem is we take things and we're like, I don't even know if it's working. Do I feel better or do I feel worse? I'm not sure.
Mm-hmm.
Do these interact with my current medications? That's a big.
Mm-hmm.
Well, as we get more morbidities, how does it interact with my current medications or even my diet? What documentation do I need to help get it paid through my HSA and my FSA? That's a big
Mm-hmm.
one because cost. I know we're all on budgeted costs, and a lot more of us are restricted. And how do I what is the plan for the cost? And is it a
Mm-hmm.
barrier to me going down this side and this going down the medical food plan? So those are all things we take very seriously at Alpha Sigma. We have a lot of programs in place. We
Mm-hmm.
try to help control that as much as possible. We have a money back guarantee on a lot of our products, which I never heard of in the drug industry before I came here.
Yeah.
I was impressed, and I recently asked how many people have triggered that. you you have a money back guarantee. How many people are taking it? It's less than 0.5% over the life of these
Oh,
products.
wow.
So I was
Okay.
impressed. I was shocked. Some of us were really shocked. People who've been here years were like, "Wow, I didn't even realize it was that impressive." And
Mm-hmm.
that tells you a lot when you have a money back guarantee and nobody's using it. It tells you a lot about the quality and what we do.
A couple of key takeaways that I take away is that one, you have to approach this whole supplement and or medical food industry with a goal in mind. There's a lot of marketing out there. As long as you attach a celebrity to it, everybody's like, okay, I'm going to do that for weight loss, or it's going to help my skin or whatever. But realize that anything that you put into your body has an effect. So make sure that you know your goals, have a written plan, and talk with your doctor about that plan and what's the goal. Are we supplementing for deficiency? Or are we again taking something for general wellness? And then realize the different costs associated with those things, and how, because as I mentioned in the beginning, this is a multi-billion-dollar industry, and it's expected to grow as people become more aware about health and wellness and want to do more.
Yeah, yeah,
Yeah.
it is. It is a growing industry. I was shocked at how much it has grown, and how much of
Mm-hmm.
an impact it has, and how much it is becoming much more of a commercialized, direct to consumer, because you have to drive the
Mm-hmm.
consumers to that side. But there's a lot of things you have to think about in this regard. But I think that's the key in medical foods, is that supervision aspect. You're partnering with your physician. You have that plan in place. There's a different purpose and oversight of it, to
Mm-hmm.
manage the needs, and there's a distinct nutritional requirement for your case. And
Yeah.
those are, people often look at it from well, these are just expensive supplements,
Mm-hmm.
and there's very much differences on it, because of that supervisory aspect needed, because of the dosing. These are therapeutic doses of things that might look like vitamins, look
Mm-hmm.
like something in a supplement, but needs that extra care and monitoring. It's definitely a bit different when you think about it.
But it's still very, I guess, it very important for people to understand. And some of the things that I use supplements and medical food for, or for instance, in like diabetic neuropathy, and the nutritional value that it shows, and a lot of the questions that patients have, or maybe they'll come back months later and say, well, I stopped taking it. I didn't really see the benefit. And you don't know that these have to build up in your body, and
Hmm.
there's a long-term effect, as opposed to just taking some immediately and getting that response like you would with like a medication for pain and so forth. But to that effect, though, I really do think that this industry, the medical foods, supplements, can help me as a physician do my job and help with conditions. A number of them we've talked about today, just vitamin deficiencies or metabolic syndromes, obesity, diabetes, neuropathy, cognitive issues,
Hmm.
Alzheimer's, or mild cognitive impairment. So um, I do embrace the growth, and think that it is, it's a good thing that we have these medical foods and supplements to help us supplement our medical food. But I want people to just realize that there are things you have to think about when you're taking these.
Well, and you have a great example. I mean, diabetic peripheral neuropathy takes you 10. 10 plus years, 15 years for the damage to show its face. It takes a little while to feed that nutrients to get the body's healing back in line, so it's
Absolutely.
not a quick fix. It's not a symptom drug aimed at a symptom. So it is. And I've often seen people go, oh, I was feeling great, but I got sick of paying that amount for it. And then they go off it, and 3 months later, they're like, that was really working for me.
Yeah.
I think I need to go back on that. That's a very common aspect, and it's that's what I think too. When people go off it because of something, and I'm like, no, that means it was working.
Exactly. Well, this has been very educational. I certainly learned a lot. I know listeners have. Any parting words you want to leave with people?
Education. Don't just go for the lowest price in this sense. Look for quality brands on the supplement side, and talk with your physician about your condition if it's a medical food condition, because you're getting into something that is high quality that you cannot worry about. If you get a supplement, it doesn't work. You don't know if it doesn't work because it didn't work, or because you didn't get enough. Or you got too much and it made you ill, or it wasn't quality enough. So that's the difference we see, and it's kind of that buyer beware now. And but educate yourself, talk to your healthcare practitioner, because they can guide you.
Well, Dr. Eric Kassel, he's the Director of Clinical Affairs and Medical Operations at Alpha Sigma. Thank you so much for joining me today and sharing your insights and your wealth of knowledge for 20, 30 years that you've been in this industry with myself and those listening in. And today was educational. And again, I hope that it helped you understand a little bit more about this industry.
It's always a pleasure, Dr. Patton.
Absolutely. So if you learned something this episode, and please share it with friends, and tune in for future episodes of Your Health, Your Wealth. I'm your host, Eddie Patton, and we'll see you next time.